Welcome back, everybody. If there are some cosmetic areas that you would like to focus on but don't know where to start and who to ask, don't worry, because our friends from the Ferguson Clinic are here to help.
And today we're focusing on facial rejuvenation. Let the wrinkles in the bags be gone.
All right, everyone, of course, wants to have the fountain of youth. Look young, beautiful, youthful, and age gracefully. And you can do that here at the Ferguson Clinic. Now, we are doing our first Makeover Monday, and of course, joining me is Dr. John Ferguson, Medical Director of the Ferguson Clinic.
It's a pleasure to be here today.
Of course, so happy to have you. Now, let's talk all things about your clinic. For those who don't know, tell us what services you provide.
Well, we would like to be a one-stop shop for all your beauty needs, whether it's surgical intervention, non-surgical intervention, skin care, spa services. We try to cover everything so that it is your one-stop shop.
Perfect. And when people come to you, wanting facial rejuvenation, what would you say is the main concern or complaint?
Well, right now, with everybody wearing masks, the primary thing is just looking old, tired, just not refreshed.
The main focus is the eyes.
Right. Definitely the eyes. And it can be multiple different things. It could be bags under the eyes, wrinkles. It could be the brows dropping down. There's just several different things. And we have ways of treating all of them.
Okay, and can you go into some detail about those treatments?
Sure. Well, it depends on what areas. And there can be a combination of areas. For the lower eyelids, where there's bags, you can just remove some of the fat that's causing them. You can tighten up the skin with a laser or microneedling. Sometimes they're a little hollow, and you just put a little filler in there to fill that up. Now with the upper eyelids, really the main treatment there is just trimming up the skin. And that really gives a nice, lovely shape to the eyes. It really can make a big difference there. What is often overlooked, though, are the brows. The brows, everybody just kind of forgets those. And as they fall down, it actually makes the skin of the lower lids even worse. And you can lift those brows up and have just a wonderful, bright-looking eye.
Okay, wonderful. And the way you talk about the treatments, it kind of seems like it's something that's potentially not too invasive or something that's quick. How are the treatments like?
Well, it does kind of range from non-invasive to a little bit more invasive. To treat the lids, it really depends what is the problem. If it's the lower eyelids, we can tighten up the skin with either a laser or deep dermal heating. For the bags, usually it's just fat. You just take out the fat and it makes a huge difference. Sometimes it's hollowing, and a filler is all you need. For the upper eyelids, it's usually trimming some of that skin. Sometimes there's a little fat that we can take out, but it's usually going to have to be something a little more invasive. But with the brows, there's all kinds of options. You can sometimes use Botox, you can do endoscopic brow lifts, you can even do some deep dermal heating non-invasively to really get you a nice smooth arch, which really opens up the eyes quite a bit.
Perfect. And it will have you behind your mask or not, looking fresh and rejuvenated.
Absolutely.
Okay, well, obviously this sounds amazing. For those who want to learn more about your services or maybe get in touch for an appointment, where do we go?
Well, you can find us online at thefergusonclinic.com. You can give us a call at 808-521-1999. And remember, all consultations are free.
Wonderful. Well, thank you so much, Doctor, for having us today.
It's a pleasure being here today.
They really do have everything you need there. And I suggest talking to them. They know what they're doing. They've been doing it for a long time, and they've seen every possible case and question that may be answered. So if you've got a question, go ahead and give them a call, and we'll have information on our website shortly after the show. And thank you to Kelly Simek for heading down there and getting the information.
That's right.
All right, early